Thanks for being here this morning on Good Day State Line. It's a tough subject, but it's out there, the opioid epidemic. Joining me now is Dr. Hayes and Dr. Carlson-Dexter from UI Health LP Johnson Family Health Center. That's a long title. We had your friends on here a couple weeks ago, but I'm practicing the title, UI Health LP Johnson Family Health Center.
Yes,
I get it?
you
Okay.
got it.
Awesome. So tell us a little bit about the center.
So our medical clinic is it's a full spectrum medical clinic. We see patients ranging from brand new babies that most of us have delivered ourselves. We follow our kids through their growth and development, see them as teenagers. We deal with adults. We see pregnant women. We see older adults. We do nursing home care. So it's really a complete full spectrum family medicine service.
And you have a seminar coming up about opioids, and we want to know what kind of approach you take for opioid treatment.
Yeah, so when a patient comes in and they have pain, the first thing that we do is categorize their pain. So we have acute and we have chronic pain. Acute pain is your normal, predictable response to an injury, whereas chronic pain is when that usual treatment period or time to heal kind of extends beyond longer than we would expect. So usually we use 3 months as kind of our time cutoff. So anything less than 3 months we would consider acute. Anything greater than 3 months we would consider chronic. So what we know at our clinic, we practice evidence-based medicine. And with that, we know that opioid therapy works really well for acute pain. So if you stick your hand on a hot stove and you burn it by accident, it takes a few days for that to heal up. We know that it would work, the opioid therapy would work for that. Whereas studies don't necessarily show that there's benefit or that opioid therapy is efficacious for chronic pain. So we never take opioid prescribing lightly either because it comes with a lot of risks. We have the risk of overdose and opioid use disorder. So our first step is always categorizing the acute versus chronic, and then we work our way down from there to determine the best treatment option for the patient.
Treatment for acute and chronic pain varies differently. Acute, as Dr. Hayes said, short-term therapy after a known injury, and then getting the body through the recovery period. So obviously, that part has a fixed interval. For chronic pain, however, it's a trickier issue because chronic pain is not something that gets better overnight, and people deal with chronic pain sometimes throughout their whole lives. In fact, about 11% of people in this country do have some chronic pain. In the past 20 years or so, pain has become one of considered the fifth vital sign, and assessment of pain is important for determining how you're going to treat a patient. So in the past, we've used a 1 to 10 scale, or we've used a scale with faces going from a smiley face to a sobbing face, depending on how severe your pain is. More evidence-based studies have shown now, looking at treatment of chronic pain, the goal is not to get rid of your pain. The goal is to make pain tolerable, and we assess how you're doing based on your level of function. So we use multiple different evidence-based assessors of a person's chronic pain to determine how effective their therapy is. So opioid therapy is not a one-size-fits-all therapy for people with chronic pain. There are so many different medical modalities for treating chronic pain that we can use now. Things that are have very strong evidence, especially for the most common painful condition that people have is chronic low back pain, and a lot of the studies that we've seen now coming out even still to this day are showing less and less evidence to support chronic opioid therapy. So, taking Vicodin or Norco daily, and studies are showing that instead using Tylenol, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen in patients that it's safe to use those in are very effective as well, and especially in combination with physical therapy. So strengthening exercises, flexibility exercises, and the physical therapy treatment of chronic pain is actually being shown to be most effective.
Okay, so with all this talk about the opioid crisis, how do we know when and what to do, when they're prescribed?
Yeah, so what we do, there's actually 11.5 million Americans that reported misusing opioid prescriptions in 2016. So we highly educate our patients at the clinic. So misusing your opioids can be intentional or unintentional. Typically it's unintentional, so we may prescribe opioid therapy for our patients to be taken every 6 hours as needed for pain. Maybe the patient looks at that and thinks that they should take it every 6 hours, so they're taking it even if they don't need it. That's unintentional misuse, and that is just a deficit with the education. Whereas there's abuse then, and that is intentional misuse of opioid therapy for a pleasurable response. So, for example, if we prescribe opioid therapy for acute pain for a patient and a family member takes it so that they elicit that pleasurable response, that is an abuse issue.
Which is probably why you have this seminar coming up.
Yes.
The opioid crisis, so what you need to know, and it's soon, it's Wednesday,
Next
June 19th,
Wednesday.
and you can get all the information about it on your website, correct?
Correct.
Which is go.uic.edu/lpjohnson.
Yes.
We have
You
it up
got
there
it.
on the screen. Of course, thank you both so much for all of that information, and if anyone needs any more, they can head to your website, right?
Yes.
Yep.
Thank you. Before we take a quick break, let's see what's going on around town.